I'm Ben Chandler. Good morning to everybody. I'm president and CEO of the Foundation for a Healthy Kentucky, and I want to welcome everybody here today to the second day of our 2021 Howard L. Bost Policy Forum. We hope that most of you were able to tune in yesterday. We felt like we had a really jam-packed session yesterday with lots of good information, a few little technical glitches here and there, but I hope the content certainly overcame that. Today, it is my pleasure to introduce to you all the 25th Secretary of the United States Department of Health and Human Services, Javier Becerra. Secretary Becerra is the first Latino to hold this office, but he is used to that kind of thing. He has been the first Latino to do a lot of things. He was the first person initially in his family to get a four-year degree from college, and of course, obviously the first one to go to law school. He got both of his degrees from Stanford, which is an accomplishment in and of itself. And he then served 12 terms in the United States Congress. And while he was in Congress, he was certainly the highest ranking Latino in the U.S. House at that time. I had the great honor to serve with him the entire time that I was there. I was there for 5 terms, and all of them corresponded with Javier's time there. And I had a lot of interactions with him. He was one of those people who came to check and see how you were going to vote on certain issues, because he was in leadership, and the leadership always wanted to know how you were going to vote, so they wouldn't be surprised. So I had one interaction with him after another, and I can tell you every single interaction was first rate. He understood the difficulties of every member's district. He is a very, very bright fellow and a decent guy all the way around. When he left Congress in 2017, these firsts that he had didn't stop. He was, of course, he got elected to be California Attorney General, and having also shared that role with him, having been Attorney General of Kentucky, I know what it's like to be an Attorney General, and to be Attorney General of the biggest state in the country is a very, very big deal. He succeeded Kamala Harris in that role when she ascended to the United States Senate, and of course, as we all know, became Vice President. And he continued to serve as California Attorney General for all of that time until he was appointed by President Biden to become the Secretary of Health and Human Services. This month, he released a proposal to reduce prescription drug costs to Americans. And throughout his career, I can tell you he has been committed to ensuring that Americans have access to affordable health care. Please welcome Secretary Javier Becerra.
Thank you, President Ben Chandler, for the invitation and for your leadership. Ben and I have been friends for a long time. I know how committed he is to putting heart and muscle behind ending this pandemic and saving lives. Let me also thank your governor, Andy Beshear, another friend from our days as attorneys general, for his smart, decisive action to fight COVID-19 and get more Kentuckians vaccinated. To Public Health Commissioner Dr. Stephen Stack, and to Vivian Lasley-Bibbs, Kentucky Director of Health Equity at the Department for Public Health, we owe you volumes for your tireless work to address the health needs of Kentuckians. Our nation is facing a moment of reckoning. This pandemic has taken too many lives and livelihoods. It has robbed children of their parents and of their teachers. It has shuttered businesses and overwhelmed hospitals. And Kentucky is no exception. We need everyone's help to fight back, and that's why I'm with you today. Kentuckians can help us save lives. Kentuckians can help end this pandemic. What we have to do isn't rocket science. Get vaccinated, take steps like mask wearing indoors, and encourage family and friends to do the same. We do these things not because they're fun or second nature, but because they work. They're based on science and evidence. They save lives. Call me crazy, and I guess some people really do, but truly, this does not require a rocket science degree, if there is such a thing. My friends, the earth really is round. How round is it? Well, more than 660,000 Americans have died from COVID-19. And because some flat earthers, especially those in places of influence, choose to peddle fiction, we're losing more of our loved ones today than we were a few months ago. Flat earthers, meet Delta. The Delta variant besieging our nation is faster, stronger, and more contagious. It spreads more than twice as easily as the original COVID virus. It went from accounting for 1% of COVID cases in May to being the beast behind the vast majority of cases today. But we're not helpless. Our loved ones are not helpless. Our communities can fight back. We have enough supply of highly effective vaccines to stop this variant. We are making sure that Americans have the facts and access to the vaccine that they need to protect themselves. And HHS is working with you, literally as we speak, to blunt this Delta surge and save lives. Case in point, our Office of Preparedness and Response has deployed a 15-person team from the National Disaster Medical System to St. Clair Regional Medical Center in Moorhead, Kentucky. You'll find them working shoulder to shoulder right now with your healthcare heroes in real time as we speak. Now, I shouldn't have to repeat this, but I will. The vaccines we have are safe. They are highly effective. More than 200 million Americans are alive today to tell you that. They've had at least one shot. We have enough supply of these vaccines to stop Delta and other variants. We're preparing boosts to supplement those already vaccinated when the science tells us we're ready. We'll have enough supply to reach out to our children under 12 when the science tells us we're ready. And we're making sure that Kentuckians and all Americans know every bit about this. Let me be blunt. If folks want to avoid a hospital stay due to COVID, they should be vaccinated. Here are the uncontested facts. Virtually no vaccinated person in America has had a severe breakthrough case of COVID-19. More to the point, 99% of Americans dying from COVID are unvaccinated Americans. And getting the vaccine is easy. 90% of Americans have access to a vaccine within 5 miles of where they live. In most places that offer vaccines, anyone can make an appointment the same day or walk in. The faster we all get vaccinated, the faster we beat this pandemic, and the faster we get back to normal. And more importantly, the safer you and your loved ones will be. The harm caused by those who lack confidence in or who denigrate the vaccine cannot be overstated. The failure to get vaccinated cannot be overstated. We only need to read the local newspapers to get a clear picture. In Idaho, public health leaders began healthcare rationing for the state's northern hospitals because there are more coronavirus patients than the institutions can handle. In King County, Washington State, people not fully vaccinated are 50 times more likely to be hospitalized and 30 times more likely to die of COVID-related illness. Here in Kentucky, hospitals have been pushed to the brink. One of your large healthcare facilities operates at 130% above capacity due to the influx of COVID patients. That's why President Biden is implementing a 6-pronged, comprehensive national strategy to combat COVID. Don't worry, I'll save the details of it for my next 45-minute speech. Sisters and brothers, if we're going to save loved ones' lives together in the months ahead, we've got to get shots in arms, and we must continue to do our part. You must continue to be the trusted messengers that our communities need. The stories of shortages of ICU beds, of exhausted medical workers, of maskless indoor gatherings of unvaccinated partygoers can sink the heart. It doesn't have to be this way. We can beat this virus. We'll beat it with the facts and the science, and we'll need to build vaccine confidence in our communities, and not just for the COVID vaccine, but for other critical and recommended vaccines such as for measles and whooping cough moving forward. We will beat COVID because we know the earth is not flat, because we know that every American, regardless of their race, religion, or politics, wants to save the life of a loved one. There are a few things I've learned in life, sometimes the hard way. If you're in Vegas, never put money down the drain of a slot machine that just finished paying off big time for the previous player. If you're in a car with your children, buckle up. Everyone. Lessons learned. Common sense. Maybe it wasn't that way before, but today, that's common sense. Why would any American not accept that common sense? Ben, ladies and gentlemen, don't you agree it's time for common sense? The clock's ticking. We will defeat COVID. But COVID's not the only game in town. We have a fight ahead against opioids. We have Americans struggling from profound mental stress from the pandemic. And we still have millions of Americans in the recesses of our country who are waiting for their chance to visit a doctor or step into a hospital without fearing that they will go bankrupt. So we have work to do. COVID is job one, but we have lots of other jobs to do. There's no time to waste. I'm confident that with the leaders and trusted voices here today, we can do our part to get our loved ones vaccinated, beat back this pandemic, and help America build back better. And we'll do it Kentucky strong. Thank you.
Thank you, Mr. Secretary. And yes, common sense is what we do need. Appreciate that message. It's a no-brainer that we all need to get vaccinated. We all just need to move forward, and we all need to work together. And we're proud of Javier's work and hope that we can get this thing moving in the right direction as best we can. All right. The foundation has prided itself for a long time, I think you all know this, for being data-driven and making evidence-based decisions for policy determinations and recommendations. That's why we do things like polling people in Kentucky to find out where they are and what they think about different health topics. This year, we checked in with Kentuckians twice. We did a poll earlier in the year, and then 6 months later, we came back and did another one, both of them having to do with vaccines, not just the COVID vaccine, but vaccines in general. And our latest poll, taken by phone with more than 500 Kentuckians, as I say, all across the Commonwealth, was finished up in September. And it showed that we reduced vaccine hesitancy, and you can see that number on the screen. We reduced it from 29% to 20%. Now, it's still clearly too high, but it does show improvement. It does show that some of the things that have been done are working and that we're chipping away at it. So that's progress. We have to say that's progress. And our poll also showed that about 5% more people are open to changing their minds about getting a COVID vaccine. There's also about 20% of people who may not be changeable, that we're just not going to do anything that's going to change their minds. Earlier this year, and this is one of the things that I think was most important about the whole poll, and this was in the early poll, we asked Kentuckians who they trusted as a reliable source for information about vaccines. I think this was one of the most important pieces of information that we gleaned. Even though it was not terribly surprising, people said that they trusted their doctors, their health providers, their nurses, their pharmacists, and local health departments. In other words, the experts on the subject of health. That makes sense. And it is not surprising that that's overwhelming. But then we followed that up with a question about whether doctors and other healthcare providers had actually contacted their patients to talk to them about getting the vaccine. And what we found there was really interesting. Only 20% of Kentuckians said that their doctor or their healthcare provider had reached out to talk to them about the COVID-19 vaccine. I found that a little bit surprising. And there were some differences throughout the state, not big differences, but slight differences where people lived. In Eastern Kentucky and in Central Kentucky, it was a little bit stronger. The outreach was a little bit better. But as you can see from that slide, in Louisville and in Western Kentucky, it was less. But the point is, I think it was a whole lot lower, and it gives us some information to ponder about how to go forward. Now, this health insurance issue is a real shocker to me. Only 14% of citizens in Kentucky were contacted by their health insurance providers to see if they wanted to get a vaccine or would get a vaccine. You can see some of the regional numbers on this as well. Very low, as you can see in Northern Kentucky. But again, throughout the state, you would have thought that the health insurance companies would have increased their output. Now, there may be lots of reasons for this. I'm not entirely sure what the reasons are, but one of the things that you see, and this shows you here, there's a disparity. We've got lots of disparities in Kentucky. There's a disparity in this, but the number across the board was really, really, really low. Only 11% of people below the poverty line, 138% and below the federal poverty level, were reached out to by their health insurance provider. So what this tells us, I think, is that we have a lot of work to do. And you immediately ask the question, I think, would doctors and health insurance providers reaching out have made a difference in where we are today? Well, I don't know the answer to that, but I do think it would, it's certainly worth a try in the future to think about seeing if we could figure out a way to get doctors and to get insurance companies to reach out more effectively and in a systematic way to the people who have not gotten vaccinated. Basically, to sum it all up, here's where we are. We have our citizens in Kentucky saying that they take recommendations on vaccines from their doctors, from their healthcare providers. And we have a situation where the doctors and healthcare providers, for whatever reason, and I'm sure the reasons are quite good, they have not reached out terribly often, only 20% or so throughout the state, to those people. If we could come up with some way to get them to reach out, and here you see on this slide, 27% did not take 27% of the people who have not taken the COVID-19 vaccine strongly agree that they take recommendations from their doctors. So that leads you to believe that another third of the people, roughly almost a third of the people, might be convinced by their doctors to go ahead and take the vaccine if the doctors reached out to them, or if nurses reached out to them, or if some other healthcare provider reached out to them. So, we may be able to figure out a way to create a system where this could happen. I think we could maybe make up some ground if we did that. Now, throughout the year, we have been trying to deal with this and trying to get doctors' messages out to their patients as best we could and to the public at large. We've been sharing messages from them through PSAs and compiling vaccine facts to make it as easy as we can for providers to make their own videos to share. We've been encouraging providers to do these videos and hopefully have different outlets, whether it be social media or whether it be television and even radio spots produced to share in different counties and different regions. We hope that they have helped, but obviously they haven't helped enough. Anyway, let's take a look at some of our PSAs.
We don't know enough about COVID, but we know one thing. The COVID-19 vaccine can keep you from serious disease or death. I took the COVID-19 vaccine for the family and the life that I love. A shot that can keep you here a little longer to do the things you love and to be with the people you love.
Take it from me, this COVID-19 pandemic is hard on us all.
But thankfully, science and medicine have developed a vaccine that's safe and effective.
When it's your turn for the COVID-19 vaccine, take it from me and help us end this pandemic.
I do everything I can to help my patients stay healthy.
Hi, Angie, how are you? Very well, thank you. How are you? I'm good. It's nice to see you today.
Things we used to take for granted, like going out to eat, going to a ball game, shopping, spending time with our family and friends, have all been impacted by COVID-19. I encourage my patients to get the COVID-19 vaccine as soon as they are able. The vaccine is safe, effective, and it's our best shot at getting back to life. Take it from me. Get your COVID-19 vaccine.
My name is Ethan Kaler. I'm 28 years old from Western Kentucky. I didn't believe coronavirus was real, and then I got COVID. And I spent 17 days in the hospital and 7 of them in the critical care unit. Had to have 2 operations, almost lost my life. Take it from me, get the vaccine.
I'm the infection preventionist at Jackson Purchase Medical Center. I have been a nurse for almost 25 years, and I can tell you that the numbers you are seeing are real. Most of our patients with COVID are unvaccinated. The vaccine can prevent severe illness and death, so take it from me. It is better to get the vaccine than to get the disease.
I thought the vaccine happened too quickly, and I wondered how that could be trusted.
As people of color, we are getting sick and we're dying more than others. But with the COVID vaccine, we're all in this together. I took the vaccine, and that wasn't scary at all.
I took the shot to protect my grandbaby, my students, and my family. I hope my family and friends will do the same to protect me.
Now, all of those people that you just heard from were Kentuckians. They were Kentuckians talking to other Kentuckians. And I want to thank the Kentucky Nurses Association, the Kentucky Primary Care Association, the Kentucky Medical Association, and the Kentucky Hospital Association. All of those groups were instrumental in partnering with us to make sure that we got public service announcements like that up and distributed throughout Kentucky. I thought all of them were compelling. Part of the question, of course, was whether people saw them or not, whether we got them out to everybody and they were distributed widely enough. I can assure you that we made our best efforts. Anyway, those, as you saw, some were doctors and nurses. Some of the folks gave testimonials. They were just regular folks here in Kentucky, the kind of folks that you would think that people would listen to. And we believe that those are the kinds of people, regular folks, but particularly healthcare professionals, who can make a difference, who can hit home the message about COVID-19. Now, I hope that you all joined us yesterday and saw some of the forum's early parts. One of our first panels yesterday brought together a group of healthcare providers from across the state talking about vaccine hesitancy. And it was a robust conversation, I thought. They discussed what they're hearing from patients and how they're responding to those patients. And this morning, we thought we'd bring back Delanor Manson. She's a nurse, a healthcare executive, a thought leader, chief executive officer of the Nurses Association, the Kentucky Nurses Foundation, and Kentucky Nurses Action Coalition. Delanor, always welcome to you, and thank you this morning for taking your time. We really do appreciate it. And you've seen, hopefully, some interesting information this morning, and I wonder if you could give us your thoughts on that, particularly relative to some of the disparities that we see.
Thank you, Ben. Thanks for allowing me to be with you this morning. First of all, I love those PSAs. I hadn't seen all of them, but they are wonderful. Some of the information, some of the data that you presented related to doctors and insurance companies not reaching out, I'm actually shocked because we are trusted. And for the most part, when we have those conversations with our patients and families, it makes a difference. So I'm actually pretty shocked about that.
I think, Delanor, it shocked me, but I think that maybe what we've got is the standard procedure of healthcare providers is essentially to wait for patients to come to them, and then they have discussions. And it just strikes me that maybe we ought to figure out a way to, in some systematic fashion, get those same providers to systematically reach out to these patients, many of whom have not presented to them.
Well, I think that's a great idea. When you talk about this outreach, I know that you all know that we've been working with the health departments around the state, and particularly in Louisville, to do a lot of that outreach, to go to the communities where people work and live, and to provide vaccinations. Some of the issues that I've been able to identify, though, is some of the people that we're serving say that they don't trust the healthcare system. And so they don't go to the doctor. So when you engage them in conversation about why they don't trust the healthcare system, it's that the healthcare system hasn't supported them. They've presented to the healthcare system and been basically turned away and their symptoms dismissed. Just this weekend, we did a testing clinic, and there was a family of 4. The mother had been to the doctor on Monday with symptoms and had not been tested. She basically was told she had a cold. And her children had symptoms. They were not tested. Her husband did not see the physician. He was sitting in the waiting room. But the point was, when they got to us 5 days later, they had an opportunity to infect a lot of people. And the mother was positive, and the children so far are negative. But my point is, she was dismissed. And because she was dismissed, her trust of the healthcare system may not be intact. And so the question for me is, what happened with that encounter? Was there some implicit bias that may have prevented the testing, or may have dismissed that patient because she was a person of color? And so implicit bias is something that exists in the world, and it's unconscious, but it can impact the outcomes of patients. And it can also impact the trust that patients have of the healthcare system when they are dismissed.
What do we do about this, Delanor? I don't think there's any question that that the implicit bias is there. There just isn't any question in my mind about it, and the statistics are clear. I don't know if you saw Eva Stone's presentation this morning, but it was just, I think, truly eye-opening, these disparities, most of which, quite frankly, are within communities of color.
Absolutely. Well, Dr. Stone is an exceptional person. I happen to know that personally. However, let me just say that the disparities are there. And as you say, the data is the data. The problem is that, when you talk to healthcare providers about that, they say, I treat everybody the same. I'm not trying to treat people of color differently. And no, they're not. But if you are unaware of your implicit biases, you don't know that you're doing it. And everyone has biases, no matter their color or their skin or ethnicity. So the best way, you ask, what do we do? Well, one of the things we can do is to learn about our own implicit bias. And as you become aware of it, you can do something with that. It doesn't mean that the bias goes away. It just means that you are aware of some of the decisions that you may make in terms of treatment. And I say treatment first before diagnosis, because if you're treating symptoms and you're not diagnosing what the problem is, you're treating something that is not completely what you should be treating. So I encourage healthcare professionals to invest in taking an implicit bias class. The Kentucky Nurses Association did a proposal to the Kentucky Board of Nursing to provide mandatory implicit bias training for every nurse in the state, as well as to embed it into the curriculum for every nursing school in the state. And we are just waiting for the final decision. If we are successful, we will be one of the first states in the country to do that. Kentucky will be ahead on this one.
Well, hooray for you. That sounds like a wonderful undertaking, and anything that we can do to help, we'd love to, and certainly wish you the best in those efforts, because there isn't any question in my mind. Again, as you said, the data is the data, and it's clear. You hear people talk all the time about the social determinants of health, and the foundation's mission is to have a healthier population here in Kentucky. Our numbers are very poor, I think, as everybody knows. And the one thing that jumps out at you is you cannot raise those numbers unless you do something about these disparities. The reason our health numbers are so low is the health status is so poor in communities that suffer from poverty, in communities of color throughout this Commonwealth. And until we lift those communities up, we're not going to, I think, move forward very much.
Well, I agree with you. But I also want to put a plug out about the historical perspective. You know, we're talking about what's happening now, but our history in the United States is not positive toward Black and brown communities. And we can't dismiss that, because that's part of the distrust. And if we have the distrust because of the historical issues, and we have the distrust of the healthcare system because of implicit bias, you know, we have a lot of things working against our communities of color. And so we have some opportunities that we can take, but it is a commitment that every healthcare professional needs to make. Every last one of us must make that commitment.
Well, it's a real challenge. And I think, as you say, the first part of making the commitment is to recognize the problem, to recognize that we do, even unintentionally, have implicit biases that we don't realize that we've got. And I don't think there's any question about it. I could confirm with you that I have those biases, and I'd like to be done with them. You know, I'd like to have them not affect the way I behave. But from time to time, you see them cropping their ugly heads up. So I think we all could use training.
I agree, and the nurses are going to get it.
Yeah, well, I know if you have anything to do with the Delanor, the nurses are definitely going to get it. You are an awfully dynamic leader, and the Nurses Association is quite lucky to have you.
Thank you, Ben. Thank you very much. And I appreciate the time this morning to talk about a very important subject to all of us, because if we don't make the commitment, it won't get done.
Well, again, this is very important, and it is extremely important, as we know, to communities of color who are our fellow citizens. But it's not just important to them. It's important to the health of the entire community, to the health of the Commonwealth, and to where we are going as a people. We've got to get there. We're not going to have the country that I think we all want to live in if we don't overcome this problem.
I agree. No disagreement from me.
Well, thank you very much, Delanor. It's nice to be with you, and I just appreciate very much you being with us and all the good work you're doing.
Thank you, Ben.
All right, we're going to have a short video, and then we're going to take a break and return with a panel on vaccine messaging. So after this short video, you can stretch your legs, get a cup of coffee, whatever you want to do, and please come back and join us. Thank you.
Hello, my name is Kevin Pierce. I'm a family physician practicing in Lexington. Today, I'd like to share with you some perspectives on vaccination. Vaccines have been a part of my practice the entire 35 years I've been practicing, and that's because they're the most powerful tool we've ever had to prevent serious disability and death. I typically discuss with my patients the vaccines they should have or their children should have, and they usually take them on the spot. But now, in the midst of the worst health crisis we've had in over 100 years, people are beginning to refuse to be vaccinated, obviously, about COVID-19. It's hard to understand. They see people dying, at least on the news all the time. They probably know some who have, yet they don't want to be vaccinated. Why would this be? I think I know, and you might agree with this, I think it's due to a combination of misinformation, misunderstanding of the facts that really exist, and mistrust. Fortunately, most people trust their primary care provider above all others on vaccine decision-making. So I get to talk to my patients, listen to them, gain their perspective, know where they're coming from, and then explain to them as best I can the benefits of vaccination, and it's very low risk. So I urge you, when you talk to people who you know are hesitant to be vaccinated against COVID-19, urge them to talk to their primary care provider or to another trusted healthcare provider. And while you're at it, remind them how important the flu shot is. Flu vaccination this year is going to be especially important because with the Delta variant there and so contagious and people not wearing masks and flu there as well, we're going to have people in the hospital very sick with flu and COVID at the same time, and many will die. This is entirely preventable. Mask up, get the shot, stay safe.